Welcome to the InfoMullet YouTube channel. If you enjoy this content, please like or share. And if you'd like to support the InfoMullet by becoming a mulleteer, visit us on Patreon. We appreciate your support. I was in early October, I was talking about this exploding oscillation cycle, and sure enough, we have it. So, oops, let me make that, there we go. So, when we talk about waves and COVID-19, the fear was an exploding oscillation pattern, which means that the next wave, the peak is bigger than the previous peak, and the trough is bigger than the previous trough. And we had that. And I think one way to demonstrate where we're at with this COVID, I mean, everyone knows it's going on. I don't need to show a chart that shows, like, look, there's a lot of numbers. But to get a feeling of what this means as a country, where we're at, this is a chart that shows the number of tests we do daily and the positive testing rate. And this is a really good way of saying how bad is this outbreak. It's one thing to say we have 130,000 cases, 160,000 cases, 180,000 cases, new cases last week. We had one day we hit over 100. Those are huge numbers. I was making predictions back in March of like 200,000 by the end of the week. We hit 180,000 in one day. But what's important to understand about this wave too, and to put it into context, is those are not all the cases. And what this chart shows is it shows the daily tests, and this is from Calculated Risk Blog. It's a website I really recommend for anyone out there who likes analytics and charts like I do. But these columns are the daily number of tests we're running. So over time, we've been running more tests. We started out in a few hundred thousands. We're up to 1.3 million. But this red line, and I've shown it time and time again, this is the metric of whether we're getting all of the pandemic in our tests, or we're only getting around the edges. And you can see early on when we had too few tests, the percentage of testing rate positive was spiking high. And I've likened this, and there's a video below that goes into more details why a high positive test rate is bad. But what it means is when you have a high positive test rate, it means you're not capturing the entirety of the positive outbreak within your test. You're just catching the edges and the boundary. And it dropped down with this trough, at the trough of sort of, it never really left wave one. I called it wave 1.5, and you see it bring back up. And this 10% level, you want to be below 5. 10% is a breakthrough number though. And you can see here that we had that midsummer peak here, July and August, then that long, again, it didn't go down to where it needed. It never got really that far beneath 5. The best practices is really around 2%, 3%. If you're testing that, that means you're getting enough, random testing, surveillance testing. When you're higher than that, you tend to just be testing people who are coming in symptomatic. Look at where we are now. It's jumped all the way back up to 15%. And that tells us that even though we're doing 1.3 million tests a day and we have 150,000, 180,000, we are barely catching the number of people who actually have this virus. And this is the danger as we go into the Thanksgiving event. And the reason I wanted to kind of emphasize COVID up front, even with election and all that stuff, we have an out of control pandemic going on in the country. And what that means is next week is the traditional, actually starting this weekend through the week after Thanksgiving, is the highest shopping volume in person in the United States all year, the biggest travel season. And the kinds of travel, it's not like, we can all go to vacation in Hawaii and visit Rory and get a fish, and like that's one or two of us going. But Thanksgiving dinner specifically has a unique thing in that it tends to bring families together from different locations. So now you're saying, here's 5 to 8 people, all from different locations, coming into an area and bringing into an environment where they're going to be sitting, they're going to be talking, they're not going to be able to wear masks because they're eating. This is an environment where you're talking about a real risk of spreading events, and we already have this massive outbreak. And that leads us right into the holiday season with Christmas. So it's really a major problem right now that we haven't been able to control or contain this. And I hate to, and I'm not doing this because I'm fearful or nervous or things like that. I'm trying to warn people, consequences are coming from this, and they have been accumulating. And don't think it's easy when you see these numbers to think, wow, 180,000, that's the worst it can get. It was so much worse than it was before. We have worse numbers coming. And part of this is, you hear these rumors, well, it's just that we're testing more. Okay, if we were testing more, the counterfactual test is to that claim is, well, if we're just testing more and we're just capturing more asymptomatic people, then the hospitalization rates should be similar, right? If we're just capturing people who are asymptomatic and there's no harm, no foul, I mean, yeah, they're spreading it, but they're not hurt, then why are hospitals filling up? And that's what this chart shows. Again, calculated risk does a good job of plotting the number of positive tests and hospitalizations over the course of the pandemic. And you can see these waves here, and this really shows this exploding oscillation, right? Wave one comes up, and you have back in the good old days of 25,000, 7-day moving average of positive test rates. That doesn't seem so bad now, but the hospitalization rate, they identified the peak here. That's what this dashed line, the hospitalization rate got up to 60,000 people hospitalized. In the summer wave, right? The summer wave, remember what I said, peak is higher than peak, trough is higher than trough. Here's the peak of the summer wave, here's the peak of the first wave, here's the trough of the summer wave, here's the trough of the first wave. Exploding oscillation, right? And you can see the hospital rate, it goes up and touches that, then drops. And it drops again here in the fall, and then it just shoots up. And now we're in a real, I mean, this you haven't seen this begin to taper off. It's a near vertical slope. And this is an exploding oscillation. Peak here is way higher than the peak here. And I'm telling you, even when this crests, I'm a system dynamicist, right? We live with these behavior modes all the time. Even when this wave crests, because they always do, they crest and they decline. The trough is going to be at a level much higher than the peaks of the previous level. And our hospital rates are also following. So this is not a case of, well, it's just we're testing more. More people are going into the hospital. And we can see that because we're running out of hospital beds, right? There's been a lot of attention on the election, but those stories are out there of now parking garages being converted into overflow for hospital beds or sports arenas or centers. Now, the good news is we built a lot of capacity for hospital beds in the wave one in preparation. And there was a lot of concern like, well, we built it and it wasn't used, and gosh, that wasn't too smart. Well, guess what? It's being used now. So there is more capacity now than there was back in the spring. But this is a view of all the states and territories, and this comes from the Department of Health and Human Services. The link is below. It just shows a histogram, which is the number of states or territories and the percentage of inpatient beds used. And you can see it's tilting to the right here. It's clustering over towards the 60% and higher. Most states are in there. A couple states are running out of room. Their hospitalization rates statewide are 80 and 90%. And these are state averages. So when you talk about a locality, El Paso, out of beds, Reno, putting people in a parking garage, specific counties and localities in North Dakota, Wyoming, these places are getting hammered because you don't get to use the capacity of the entire state unless you start moving people around. You only can use the capacity that's there in front of you. And this is one of the problems here, is that we're running out of that room. And so consequences follow. As we rise to these new cases, we increase the hospitalization rate. That is a real consequence. This isn't just asymptomatic. And after hospitalization comes death. And the death rate here, this is the chart I've used several times. It shows the daily deaths and then a 7-day moving average smoothed out. There's a few times we had data dumps where they would put in, and I've marked those, where states would add, very high totals of death that were sort of like revisions. But you can see here, again, much higher peak. In this case, because of the deaths, the peak is higher earlier, and it's not an exploding oscillation in deaths yet, but the risk is it's going to become so. So we've already, the trough of the first wave, the trough of the second wave is already higher than the first. The peak was not as high, and we're accelerating again. Now, this line here, 1,000 deaths a day. And we're kind of, we have that weekend cycle where it's getting down to 500, 600, but we're seeing in the middle of the week now numbers like 1,500, 1,800. This wave, we're going to see in December, we may see 3,000 people dead a day, and that's going to crest this early peak. If we get to that point, and I'm pretty sure we will because of the conditions coming up. It's winter, everyone's inside, the holidays are coming up. But these are the consequences. This is why I'm doing this now. If you can do anything in the next 2 weeks that reduces exposure during this Thanksgiving break, and I'm saying, check your Thanksgiving plans, check who's going to be involved in it, check how you're going out and doing your shopping for Thanksgiving, shop online versus in person. Certainly don't do Black Friday. If anything you can do now, it won't stop this from happening, but it may take the edge off before we go crashing into this really bad circumstance of this wave 2, or some people are calling it wave 3, exploding oscillation that's hitting. Now, the only two good rays of news here, well, three actually, is one, the flu season is starting light. The flu season, I'm starting to see reports of flu coming in, and it's looking light right now. That doesn't mean it's going to be light all year, but the thing that the nightmare scenario is a high wave 2 COVID-19 intersects with a high flu, and both of those have hospitalization requirements using the same set of hospitals. And our hospitals are not built to handle a nasty flu outbreak and a nasty COVID outbreak. We're struggling with the COVID right now. So good news one is that the flu outbreak seems a little light, but don't bet on that. Let's hope it stays. The second good news is we are getting better at treating these to keep people from dying. We know a lot more than we did in the spring, and you can see this in the death rates being slightly reduced, but that's only when you get hospitals. Once we run out of hospital beds, your chances are pretty low. And the third good news is the vaccine announcements from both Moderna and Pfizer, which I won't be answering too many technical details on because we're going to do the article from Science Decoded, and they'll have a lot more details in the in that article. But let me go back and just kind of catch up on some questions from this. Ed saying this AMA has more work done than the president or vice president has done re COVID-19 in the last week. Yeah, group projects are tough, Ed. You know, the United States, we're in a COVID-19 group project, and we're all sharing the grade. So unfortunately there. Yeah, still there's massive misinformation and denial on social media. You know, these things are, you know, I'm starting to see people take this more seriously because people close to them. There is now no part of the country that hasn't experienced. We're going to go over here in a second of how bad this is in North Central now. So the myths that were out that this doesn't affect rural areas, and I've been fighting these myths for months because they do not make sense. But, you know, rural areas aren't going to be bad, or it's only cities, or it's only democratically controlled places, or Republican controlled, or the temperature's going to get warm, or the temperature's going to get cold, or, you know, all of these things have been disproven. And I know some people are going to hold on literally until the day they die. There are some people who have COVID that are still in denial. They won't wear masks in the ambulance, things like that. But I'm hoping that more and more people are taking this seriously as it gets real in their area. Trisha's asking, do you know what the current estimate of asymptomatic infections is? No idea. I would say several multiples of what we're seeing in positive cases. So if we get, you know, to say baseline, you get 100,000 new cases a day, spitball it. You got 500,000. I mean, we're at numbers that are hard to make those estimates about. We are so far outpaced our contact tracing capability that it's not even funny at this point. I'd say it's pretty high is the asymptomatic infection. Yeah, people are talking about dinner, you know, dinner with their son, these bubbles, once you cross bubbles, unless everyone in that bubble, you know, has been isolated and you trust that they're telling you the truth, you are bringing into contact everyone that was shared with that in that bubble. And so it kind of, yeah, and Susan's saying it's very much like HIV/AIDS contact tracing. It's like STDs, right? If you sleep with someone, you're sleeping with everyone they slept with. Dinner's not the same as sleeping, but the concept holds. You bring someone in your bubble, you brought everyone they've interacted with in your bubble as well, based on their, you know, are they masking, social distancing, their practices. So keep these things in mind. Saying, Trisha's bringing up here, the exploding oscillation to prove that masks don't help. What doesn't help is ignorance, and that's the thing that we got to fight. And I'll show, and Trisha, stay tuned, because I'm going to show, you know, I'm going to show the pandemic response of different countries, and you can take that clip and shove it right back at them for about masks not helping. Masks alone aren't enough. I want to be clear, that's a component, but you have masks, social distancing, lockdowns, you have all these tools, and we need to use them in a concerted fashion. Available beds doesn't mean that the hospital near you yeah, Charles is pointing out the ICU bed space isn't distributed evenly. This is good. Yeah, Derek's mentioning families just decided to cancel holidays for this year. Too many registered nurses, security and logistics folks, as well as family members at high risk to be dumb about it. Good call, Derek. Thanks for watching the video. Hope you enjoyed it. If you'd like to follow the InfoMullet, visit us on Facebook or Twitter. And if you'd like notifications when we post new video content, click on the red subscribe button below the video. If you've ever wanted to become a mulleteer and support the InfoMullet, visit us on Patreon. We appreciate the support.